Hello, everyone. I am very, very delighted to have with me Dr. Antriksh Vahi, a proud Damzonian, and he has secured an amazing rank 60 in PGI June 2020 postgraduate entrance exams. Heartiest
Thank,
congratulations, Antriksh, for your wonderful performance.
thank you. Thank you.
And Antriksh has had an awesome journey. He secured a fairly good rank in NEET as well, a 3,500 rank, and he decided not to quit but go ahead for the Central Institutes. And here he lands up with an awesome performance. So I think this is something to learn from Antriksh. So let me first ask you, when you wanted to start all over again after NEET and appear for the Central Institute exams, what was one thing that was going on in your mind? And I'm sure maybe some people also suggested you to take up something and exit or things like that, but what was going on in your mind when you started your preparation?
Definitely, ma'am. At 3,500, I was getting certain colleges in Maharashtra, and my friends were suggesting that it's better that you take if you want, because the more time
Right.
you take, sometimes it gets difficult. It can go either way. It can be you may do definitely better, or sometimes it may be the other way around. But I wanted
Right.
to definitely take a chance, and because I knew that I can read better and do much better in the Central Institute exams.
Right. So I think this is something which is very, very important, not to quit until you really get what. I mean, you will always have options, but to know that you are not going to sort of settle with this. Now, tell me, Antriksh, it's been quite a long journey with DAMS, and you have been a foundation student with us. And then you followed up with test and discussion, and then the AIMS TNT again as well. So tell me, how is this? How would you describe your journey? And whether you think that starting early did give you an advantage or an edge as well.
Definitely, ma'am. So, in back in my college, I'm from Jipmer. I did my MBS from Jipmer. So,
Right.
the preparation there, the post-graduation preparation starts there in the third year MBBS, like. And so
Right.
it was at that time when I joined second year, DAMS Sky course was opened there. So me and my
Right.
friend made a point to make sure that we join DAMS right from the very beginning, because the earlier you make your notes, the earlier you get your concepts clear, the better it is. And when you enter into the final year, or you enter into the clinical courses, the clinical subjects after the paraclinicals, with a strong base of the paraclinical and the basic sciences, then it becomes easier to integrate those subjects and to learn the clinical subjects with more fun. Yes, ma'am. So I was saying that pre-foundation, that foundation course in second year, it helped me in the way that like building up concepts about the basic sciences of the first and second year. They help you learn the clinical sciences of third and fourth year in a much easier way and in a more fun way. Like you can integrate things better. You can learn things better when you are going through. You are done with the foundation course. So in that way, it was a great help for me.
Right. And how about the AIMS TND and the test and discussion course that you have done? I mean, how did it help you in the sense on what you should focus from NEET to Central Institutes in this 5 months?
Right, ma'am. So whatever I got in NEET was based on my previous, like whatever little I could read, or what notes I had revised them. But post January, I realized that there was a consistent lack was there, like in the preparation, because of which, and I knew I could make up for it. So everyone
Right.
knows that, मतलब अगर करना है तो DAMS TND करना है, जो 3.5 months में it will give you everything. So
Right.
me and my friend both decided to join the live classroom course, because we realized that the classroom course with the live interaction will be much better. And so we came to
Right.
Delhi. So in the
Okay.
3.5 months, that course duration which was there, so all the 19 subjects were covered, and the all the subjects, like the question papers were made, they were curated according to the aims, and not only just aims, like a point was made that all the central institutes are kind of covered in them. All the important topics were covered, questions were covered, and then a lengthy discussion was done on them, especially anatomy, especially pathology, and PSM. It was very, very high, like direct questions were there. And when it comes to small subjects, especially like radiology by Sumer sir, dermatology, like they are having a small weightage in aims. So we cannot go through the entire notes which we have, or what we have read before the Central Institute exams, because we have to revise also. So that TND is crisp, and that is all what is needed. So if we can just go through it again and again with that TND, that is enough.
Right. And, Antriksh, I would definitely want to know, now that you have given all the three Central Institute exams, right, whether it is AIMS or PGI or JIPMA, what do you think is the main requirement for anybody to crack these exams? And if you could analyze the three papers for us, what special things are required or what subjects to particularly focus on?
Yes, ma'am. When we come to AIMS, the entire focus or most of it goes towards the first 2 years. Like the general sciences, they get a heavy weightage in AIMS, especially in this slightly atypical paper, which is a bit more
Right.
fact-based, less conceptual, and no videos or images. And then
Right.
in the third year and final year, specific topics like trauma and surgery, like specific topics are being hit again and again. PSM, unfortunately, this time biostats and all was not there, but
Yes.
previous to this year, like specific things were there. But new programs, basically all the new programs, new updates, not only for AIMS, all of the Central Institute exams are targeting on the new updates. But when we come to PGI, ma'am, most of it is focused more on the final year subjects, the third year subjects, clinical integration. And when I sat for the exam, actually, it was like that. It was more like a AIMS like paper for me, as in the concepts were tested, images were
Yes.
given, though videos were not there, but almost everything was clinically integrated. So usually that fact-based thing, which direct like causes of it, usually PGI tests the tables. So that was very limited. So exact rote learning thing was very limited. So it again shows that in the next coming with this online exam, it's much more like it will be a more AIMS-like paper. And JIPMER
Yes.
also, we know that JIPMER usually in the past 2-3 years was giving questions like 30% or even 50%. You have to just dodge the questions and better leave them. But
Topic direct from research work, I think.
but since the last November 19 paper and this paper, it was exactly like if you have read the concepts, if you have read the basics, and you have gone through your TND notes and revised it
Yes.
again and again. So most of it was a balanced, very balanced paper.
Great. I think that's a very, very, good insight into all the three central institutes, which is going to be a very vital piece of information for any aspirant of these exams. And also, on the same note, I would really want to ask your strategy. Although these three are separate exams, but do you think when you are preparing that you should or one should do something really different for all these exams? And also, again, I would like to ask, although we call it as a AIMS TND paper, but the course that we have kept, but do you think that it is good enough for all central institutes?
Yes, ma'am. It actually, the AIMS TND course, it covers almost everything. And now what we have seen is that certain specific topics, and it's not like only AIMS. All the central institutes are hitting on the main core topics, be it trauma. Like trauma, it was said that AIMS means trauma, you should be thorough with it. But even in PGI, 3 to 4 questions were directly from trauma. And this is just
Yes.
one. In this way, like they are hitting the same topic. So that TND course is not only for AIMS, actually, it's a whole package for all of the central institutes. So my main focus primarily was revising the TND notes again and again. And the limited notes or whatever topics I had read. Like in this 5 months, I made sure like I made limited revision of the books, like books and all. It was very difficult for me to go through. Even if I tried reading a book or so, without revising it, it won't help me. So revision was what I thought is the most important thing. So the TND notes and my own specific notes, whatever I could revise, I tried to revise them at least 3 to 4 times, or how many times I could do. So that was the main thing.
I think that's a very, very important thing that Antriksh is actually putting across, that, it is not possible to do bulky things close to exams. And in fact, that is a bad strategy as well. Close to exams, it has to be crisp, high yielding material, which you have made by yourself, because then you exactly know in how much time will you take to revise a particular thing and how many times can you go through your own set of notes. So that's very, very important to keep it selective close to exam and not really keep adding a lot of bulk to your study material. And Antriksh, you've scored really, really well. And, I would really want to ask you, what is so special about Antriksh that makes him, come into the top ranks in central institutes? So as a topper or as a high achiever, what is the quality that you would say that you have that has brought you so far?
I think hard work and the mindset that yes, we can do it, because kabhi na kabhi to hoga. So darna is not the thing. Like if we make our mindset that we can do it with hard work, and we should, that the thing is that FOMO is there, because yeah, the other person is doing, we should also read this. If he's reading that,
True.
this fear makes us read everything, and at the end we are able to only revise it once. So I think hard work, revision, and the mindset that yes, we can do it. If, because at times you may not do that. I was not able to do that good in AIMS, but and like PGI exam was just one day later,
I
but
was
still I
about
thought
to ask
yes.
you the same thing. Exact this question I was going to ask you, that, how did you deal with, there may be certain phases when, you're not performing to your optimum level, although you know that you're capable of so much more. So how did you actually keep yourself motivated, or, persistent, I would say, so that you don't lose focus, so that you don't lose track? Because that is, I think, something that really reflects a topper or differentiates a topper from probably someone who's not able to score so well.
Ma'am, actually, I had never read or prepared in specific for the PGI exam. Like, but
Right.
aims was going in the mind, and hence. But when I came after the exam, I was like a bit disheartened because it was an atypical paper. So at that
Yes.
time, mind was also not working. But then when I talked with the friends, everyone said that it was not that good. And then I also realized that jo ho now. So
True.
only one day was there. So I made sure that I took a break for at least half a day. I just tried to relax myself, calm myself back down, and then again I just went through the PGI papers that have been given in the dams, because the video solutions are there. You can easily go through them, and the
Yes.
answers of questions you don't know. I just quickly went through them, whatever the latest to, and exam. Let me just give what I can do now for PGI.
I think that is again something very, very important that he has said, that, despite the fact that he could not perform that well in AIMS, according to his own opportunity. So this is a mindset of a topper. Whether you take, you take stress and you feel bad about it and it spoils your other exam as well, or you take the next exam as an opportunity to, in fact, do even better, go with a better mind frame, and make the most out of the opportunity as well. So I think that's wonderfully put, Antriksh, and it shows, the strength of mind and willpower that you have, which I think is very essential for these competitive exams, and to be a good doctor as well. Willpower is something that we definitely need to be, as we say, a lambi race ka ghoda. So, to ensure that in your journey of being a specialist, then a super specialist, and it just goes on and on for us. So, this willpower will take you a really long way, and it makes you so much special as well. Great. And Antriksh, now I would also want to I like to ask, if I was a junior listening to you, I would really want to know, what did Antriksh do, let's say a month before the exam, that really helped him to give him that acceleration that was required?
So the last month before the exam, the main thing is like I will go through again and again the revision point of view. I would like to start revising my TND notes. I will like to I will pinpoint specifically the things which I don't remember and highlight them, so that in the last week, because in the last week and rather in the last 3 days, we have to be very specific and we have to revise only the points which we don't know. And then according to that specific exam, what is upcoming exam, if it is asking formulas, be it JIPMER, whatever it be, so those specific things we can highlight, we can make sure. And especially in the last month, whatever questions you have been through in eMedicos, in your TND, the mistakes that you have made, it is very important if you can revise those mistakes, because somehow in our mindset, when we see a new question, we try to apply our thinking goes in the same way. So we should try to avoid the silly mistakes to reduce the number of mistakes, because that helps a lot. So revision of the questions of the sort, not as in new questions, what we've already done, the mistake, and revision of the TND notes and concising them so as to limit your revision to the minimal thing needed for the last 2-3 days is, I think, what is needed for the last 1 month.
I think that's again super important, and that's something that he had specified earlier on as well, that he had a broad study plan when he was a little farther for the exam, and as he kept approaching the exam, he made it more and more selective. And that's exactly how it is. Only then you will be able to do multiple revisions and be able to recall things that are required for the exam. Okay, I would want to ask you, Bache, with your AIMS TND, you got access to the AIMS capsule as well. So tell me, did you utilize that resource, and do you think that it was effective for your central institutes?
Yes, ma'am, definitely. Like utilizing AIMS capsule can be done in two ways, I think. One,
Okay.
in the last month, many people can use it as a revision tool because it concisely gives you what is needed, and it can be a last moment help for you because you can again redirect your revision to a limited time span and you can revise that thing again and again. But for me, when I was starting any subject, because I had only 4 months or rather 3.5 months to finish my primary thing, so I would start the subject's preparation with the AIMS capsule. And I would
Okay.
make sure that at least what is being told in the AIMS capsule, I should be thorough with it because most of the questions are either directly or indirectly from there. So those
Right.
topics, that concepts of the topics should not be missed. So I always made sure that because every capsule will be highlighting the topics first, and then we also go into and regard. So the capsule I used it as my starting point actually for each subject before
Right.
starting the preparation for it.
Okay, so that's interesting. That he's put out a point. So you select how you want to do it, whether you want to start from those topics or you want to keep it as a rapid revision tool, and whichever way suits best for you. And he's done it twice, so at the beginning and towards the end. Okay, so now let me ask you, Bache, you have already told us the importance of giving the test and correcting your mistakes in the test. How about appearing for the AIMS mock or the CBT that we had kept close to the exam?
Yes, ma'am. My first CBT rank was good. I was able to get a score of rank 1. So,
Wow.
and in the second, I got a rank of 20, rank 20 in the CBT. So I was knowing that, yes, I'm able to I'm going in the correct direction. But
Good.
the same thing, so revision is the key. So I made sure that whatever I'm doing, because in the last month, it really homework is there because someone will tell you something that yeah this or so even while revising the questions that were because it was a very crisp exam and even the previous year questions were asked in it. So I'm
Yeah.
whatever mistakes I was doing, I was trying to revise them.
Okay.
So it gave me
Great.
the
So
motivation actually that I can do it.
great. And since you're talking about motivation that you got, I'm sure you are going to be a source of motivation for your juniors as well. So let's hear it from you. What would you want to tell your juniors or who are aspiring for central institutes and would want to do as great as you have done? What would be your advice or your motivation for them?
So my point is that we should start as early as possible. We should try to limit our resources when we are starting, in the sense that we should try to make our own notes. We should make our own concise notes of each subject so that we can revise them in a short span of time. And when in the initial period, like when you're preparing during your MBBS courses, if you can go through the good books, if you can read them, the standard textbooks at least once, especially when we know that they're targeting pathology, they're targeting Bailey for surgery, and
Yes.
so specific textbooks, especially for them, if at least once we can go through them, because these are textbooks which you cannot come back when it comes to revision time or in the just 5 months before the examination. So that
Very
will
correct.
also give a boost to you. At the end, अगर नहीं भी हो रहा है, कुछ नहीं हो रहा है, तो we should not get disheartened because हो जाएगा, because sometime you will do it. So we should have the confidence, or the hopes should always be there that yes, we can do it.
Great. I think that's a great piece of advice from the beginning towards the end of the journey and how to handle your lows, as well. And, since you said it beautifully before, I would just want you to summarize it in the end as well. What do you think are the three most important ingredients to be a good rank holder when it comes to these exams?
Yes, ma'am. Hard work, specific limited resources which are centered towards the exam you want, and revision.
Right. I
Three
think
things are
very
needed
appropriately
to
put,
fill the exam.
very well put by Antriksh. So, what branch do you want to pursue, Antriksh?
Still deciding on it, ma'am.
Still.
Surgery, ophthalmology, like on the surgical side.
Great. And I'm sure I can see a great surgeon because, you have so much of determination that you're going to do, you have willpower, you're going to do well as a surgeon. And I wish you a very, very bright future ahead. And I would also want to
Thank you.
congratulate your parents, for giving you the kind of support you needed at your during your preparatory phase. So please congratulate
Thank you.
them on my behalf. And if they want to be in the interview as well, it will be great. Are they around? Are your parents around?
No, I'm in my room, but I'll definitely convey the regards. Thank you.
Sure. And we wish you all the very best from the entire Dams family. It was a pleasure to have you here, and I'm sure you will give us an opportunity again when you clear your MCH, and we will have Antriksh back on our channel to guide people about their MCH and super specializations. So it's an absolute pleasure, Antriksh. You have a wonderful personality, and I'm sure you're going to do really, really well, whatever branch you may take. So lots of good
Thank
wishes,
you.
and keep smiling always.
Thank you.
Thank you, Bache.